Raymond opened his patient portal at 11 p.m., couldn't sleep, checked if lab results were in. They were. PSA, abnormal, 7.2 ng/ml reference range, 0.0, 4.0 ng/ml, 11:02 p.m. Googled PSA 7.2. First result, PSA levels and cancer risk. Article said, PSA between 4 to 10 indicates 25% chance of cancer. 11:05 p.m. Googled PSA 7.2 survival rate. Results showed 5-year survival statistics for prostate cancer. 11:12 p.m. Googled PSA 7.2 symptoms cancer. Found articles about bone pain, weight loss, urinary blood. Started mentally checking if he had any symptoms. 11:20 p.m. Googled, how fast does prostate cancer spread? Read about metastasis, lymph nodes, bones. 11:31 p.m. Googled PSA 7.2 treatment options, surgery, radiation, hormone therapy, side effects. 11:45 p.m. Googled prostate cancer stories PSA 7. Found forums with men discussing their diagnoses. Midnight, still reading, heart racing, couldn't stop. 12:30 a.m. Finally tried to sleep, couldn't. His wife woke up, found him on his phone at 1 a.m. What's wrong? My PSA came back abnormal, 7.2. I think I have cancer. She started crying. Neither slept that night. Next morning, he called his doctor's office immediately. Doctor called back that afternoon. Raymond, I see you got your PSA result, 7.2. Before we talk about that, did you Google it? Raymond admitted. Yes, spent hours last night reading about it. His doctor, that's what I was afraid of. Google gives you statistics without context. Let me give you your context. You're 66 years old. Previous PSA 2 years ago was 6.1. You've gone up 1.1 points in 2 years, about 0.5 per year. That's consistent with benign enlargement. Your digital exam last year showed smooth, enlarged prostate. No hard areas, no nodules. You have moderate urinary symptoms, classic BPH pattern. Your 7.2 is almost certainly from enlarged prostate, not cancer. Google told you 25% cancer risk for PSA 410. But that's for all men in that range. For men your age, with your exam findings, with your PSA trend, your individual cancer probability is probably under 10%. Much lower than Google's general statistic. Raymond felt foolish. So I panicked over nothing? His doctor. You panicked over incomplete information. Abnormal on lab plus Google statistics equals terror. Abnormal plus your medical context equals likely BPH, needs monitoring. Very different conclusions. Next time, call me before Googling. Raymond learned. Midnight Google searches with abnormal lab results create panic. Morning conversation with doctor who knows your context creates understanding. Today I'm revealing why Googling abnormal PSA makes panic worse. The missing context that Google can't provide. And what to do when you get abnormal results outside office hours? If you Googled your abnormal PSA at night, this could explain your escalating terror. This video is for education only, not medical advice. This is about understanding test results in context, not self-diagnosing. Always work with your doctor on PSA interpretation. Individual situations vary. Now let me show you why abnormal PSA needs context before it means anything. The word abnormal on lab reports is designed to catch attention. It works. It catches attention extremely well. Too well. Raymond's panic wasn't unusual. It's nearly universal. Studies show about 75% of people who see abnormal on medical test assume serious disease. For PSA specifically, most assume cancer. But abnormal on PSA report simply means above the reference range. The reference range for most labs, 0 to 4 ng/ml. This range was established decades ago, based on population averages, not individualized to you, your age, your medical history, your prostate size, your symptoms, just population average. For a 20-year-old man, PSA above 4 would be very concerning. For a 70-year-old man with enlarged prostate, PSA of 7 or 8 might be completely expected. The lab doesn't know which you are. It just flags everything above 4 as abnormal. This creates enormous problem. Millions of men get abnormal PSA results. Most panic before getting context. Many, like Raymond, Google at night. Make panic worse with incomplete information. Raymond's Google search pattern is textbook. Starts with the number, PSA 7.2. Gets general cancer risk statistics. 25% chance of cancer for PSA 410. This statistic is technically accurate but completely lacks context. It's for all men with PSA 4 to 10, young and old, first test and 20th test. No symptoms and severe symptoms, all lumped together into one 25% statistic. Raymond's individual risk is not 25%. His doctor later told him, probably under 10%. But Google can't know that. Google doesn't know Raymond is 66. Google doesn't know his PSA was 6.12 years ago. Google doesn't know his exam showed benign enlargement. Google doesn't know his symptoms are classic BPH. Google just gives population statistics, which sent Raymond into deeper panic. Each search made it worse. Survival rates. Now he's reading about people dying. How fast does it spread? Now he's imagining metastasis. Treatment options. Now he's reading about surgery side effects. By midnight, Raymond was convinced he had advanced cancer, based on seeing abnormal and Googling general statistics, neither of which accounted for his specific situation. When Raymond's doctor called, everything changed. Not because the PSA number changed, still 7.2, but because the doctor added context. Context factor 1. Age. Raymond is 66 years old. PSA naturally increases with age as prostate enlarges. Expected PSA for age 66 can be up to 6.5 normally. Raymond's 7.2 is slightly elevated for age, but not dramatically. Google's 25% statistic doesn't account for age. Context factor 2. PSA trend. 2 years ago, 6.1 this year, 7.2 increase, 1.1 points over 2 years. That's about 0.5 points per year. Research shows PSA velocity under 0.75 per year is generally reassuring. Raymond's 0.5 is well within normal progression range. Suggests benign enlargement, not cancer. Cancer typically shows faster or more irregular increases. Google doesn't know Raymond's previous PSA, can't calculate his trend. Context factor 3. Digital rectal exam. Raymond's exam last year, smooth, enlarged prostate, no hard areas, no nodules. Cancer typically feels hard, irregular, or nodular on exam. Benign enlargement feels smooth and uniform. Raymond's exam suggests BPH, not cancer. Google doesn't have Raymond's exam results. Can't factor this into risk assessment. Context factor 4. Symptoms. Raymond has moderate urinary symptoms. Getting up twice nightly, weaker stream, some hesitancy. These developed gradually over several years. Classic benign prostatic hyperplasia symptoms. Cancer usually causes no symptoms in early stages. Urinary symptoms typically indicate enlarged prostate pressing on urethra. Mechanical issue, not cancer. Raymond's symptoms point to BPH. Google asked, "Do you have symptoms?" but couldn't interpret the pattern. Context factor 5. Prostate size. Raymond's prostate on previous ultrasound, 68 cubic centimeters. Normal prostate, 20-30 cubic centimeters. Raymond's is more than double normal size. Larger prostates produce more PSA naturally. PSA density calculation, 7.2 divided by 68, 0.011. Under 0.15 is generally reassuring. Raymond's density is low, despite elevated total PSA. Google doesn't know prostate size, can't calculate density. His doctor calculated Raymond's individual cancer probability, not Google's 25% for all men with PSA 4 to 10, but Raymond's specific probability based on all factors. Age 66, PSA trend slow and steady, exam benign, symptoms consistent with BPH, low PSA density, estimated individual probability, under 10%, maybe 7 to 8%. That's very different from 25%. Even more different from the "you're dying" conclusion Raymond reached at 1 a.m. The recommendation? Additional testing to be thorough. Prostate MRI to look for suspicious lesions. Free PSA percentage if not already done. Follow-up PSA in 6 months to confirm trend continues. But not immediate panic, not assumption of cancer. Informed monitoring of likely benign condition. Looking back, Raymond wishes he'd handled it differently. 11 p.m. saw abnormal PSA 7.2 on portal. What he did, immediately Googled. Spent hours panicking. What he should have done. Noted the result. Closed the portal. Called doctor in morning. His doctor explained, "I know that's hard when you see abnormal. Human nature to want answers immediately. But midnight Google searches with medical results almost always make anxiety worse. You get statistics without context. Worst-case scenarios without probability. Forum posts from people in completely different situations. None of it applies to you specifically. Better approach when you get abnormal result outside office hours. Note the result. Write down the number. Resist the urge to Google immediately. Make note of questions for your doctor. Call doctor's office first thing in morning. Request callback to discuss results. Get your context before seeking general information." This is incredibly hard to do. The panic is real. The urge to Google is overwhelming. But every doctor will tell you, wait for context. General internet information without your specific medical history creates more fear than clarity. Raymond's experience shows the dramatic difference. 11 p.m. to 1 a.m. Abnormal. Plus. Google, so convinced he was dying. Next afternoon, abnormal, a plus, doctor's context. Likely BPH, needs monitoring. Same PSA number. 7.2 both times. Completely different understanding. One created crisis, the other created informed plan. The difference wasn't the test result. The difference was context. His age, his trend, his exam, his symptoms, his prostate size. All of this together painted accurate picture. Abnormal alone painted terrifying picture. When you get abnormal on PSA test, here's what it actually means. It means your PSA is above the population reference range. It does not mean you have cancer. It does not mean you're dying. It means further evaluation needed with proper context. The context includes your age. What's normal for your age group? Your PSA history? Is this new or part of existing trend? Your prostate exam? What does your prostate feel like? Your symptoms. What urinary issues do you have? Your prostate size? Is elevated PSA proportional to size? Your family history? Do you have genetic risk factors? Additional biomarkers? Free PSA, PSA density? Others. All of these together determine what abnormal actually means for you, not what it means for population average, for you specifically. Raymond got the recommended additional testing. Prostate MRI, no suspicious lesions. PI RADS, 2, low suspicion. Free PSA, 22%, reassuring level. 6-month follow-up, PSA, 7.4, minimal increase. Stable trend continues. Final assessment, benign prostatic hyperplasia. Monitor annually. Consider medication if symptoms worsen. No cancer, no crisis. Just common age-related prostate enlargement. Everything his doctor told him on that first phone call was correct. His midnight Google panic was unfounded. Not because he was foolish, but because he had incomplete information. Abnormal without context creates panic. Abnormal with context creates understanding. If you got abnormal PSA result, first, don't panic. Abnormal is not a diagnosis. Second, don't Google at midnight. Seriously, it will make it worse. Third, call your doctor's office in the morning. Fourth, ask for your complete context. What was my previous PSA? What's my PSA trend over time? What did my last prostate exam show? What's my prostate size if measured? What's my individual cancer probability given all factors? Fifth, get additional testing if recommended. Prostate MRI to look for lesions. Free PSA or other biomarkers. Follow-up PSA to confirm trend. Sixth, Make informed decision based on your complete picture, not Google's general statistics, not fear from the word abnormal. Your specific medical context. Raymond spent hours in midnight terror. His wife cried thinking he had cancer. All from the word abnormal plus Google searches. His actual situation: benign prostate enlargement. Common, manageable, not cancer. The panic was real, but unnecessary. Context would have prevented it. If you got abnormal PSA, get your context before you panic. Subscribe for next week's video on the specific follow-up tests that determine what abnormal PSA actually indicates. Raymond's midnight Google spiral is a cautionary tale. Don't let abnormal without context destroy your peace of mind. Get the complete picture first.